Have you ever heard someone being said as he or she has a screw loose? I really believe many of you have heard this. Actually, in real term, it means that the person behaves in a very strange way and seems mentally ill. These words are connected to the term psychosis. So, what is psychosis? Psychosis is a group of mental health disorder characterized by loss of contact with reality. Psychosis causes the distortion of senses and signals of brain. People with psychosis are called psychotic. In this video, I will discuss about the drugs that are used in the treatment of psychosis, the antipsychotic drugs. Before we really go into the drugs, we should know about all the related psychiatric terms. Psychotic patients are having contact with a world that is not real. So let's get into that world to see how the psychotic patients are dealing with. Psychosis is characterized by lots of syndromes. There are generally four cardinal features that a psychotic patient may develop: illusion and hallucination, delusion, disorganized thoughts, agitation, and aggression. So, what are these? Let's look at these with examples. Illusion. Illusion is misperception of something. In this case, the brain receives a signal of something but perceives it in a wrong way. For example, think of someone working on his laptop in his room. Suddenly, he heard a sound. He feels like someone is talking inside the toilet. He again tried to understand what was it, because there was no one in this room. But he again heard the voice. So he decided to check, and so he opened the door of the toilet. But what he saw made him really shocked. It was actually a tap water running. There was no one talking. For some moments, what happened here? The sound of running water was perceived by the person's brain as the voice of someone. This is a misperception, and this is called illusion. Right. Now, come to hallucination. This terminology has a very big area. Hallucination is a perception of something without a stimulus. It means the person will feel the existence of something which does not really exist. For example, take the same person, he is working on his laptop in his room. This time, suddenly he has started to hear something, some voices. Maybe someone is talking to him. But he looked around. No one was there. He searched the room. He went to the toilet to check whether there was anyone. But actually he found no one and nothing happening. But he is continuously hearing the voices. Those are talking to him. And he is getting very anxious. This is hallucination. Actually, no one was there. No sound or voices was there. But his brain's auditory system was auto-generating some sounds or voices in his mind. That's why he was hearing something which was unreal. This is hallucination. Hallucinations can be of different types. Generally, 5 types of hallucinations are there. The example we have seen right now is auditory hallucination. The person hears something which is not there. And just like this one, someone may have other types of hallucinations such as visual hallucination. The person can see something which is not actually there. In the previous example, if it was not a sound, just think if it was someone, who may be sitting in front of him. He is watching him, but he's not actually real. So he can see something which is not real. Another example, suppose someone who is very addicted to cocaine may suffer visual hallucination. He may see some bug maybe moving on his skin or on the floor, but actually nothing is there in real. These two types of hallucinations, auditory and visual, are the most commonly occurring hallucinations. Now, tactile hallucinations. This is a kind of somatic sensations, but without any stimulus. For example, the cocaine addicted person may feel that bug is moving on his skins all over his body, but he does not see it. So he tries to rub his skin continuously, but actually there is nothing. This is tactile hallucination. Then gustatory hallucination. The person may feel the taste of something without putting anything in his mouth. For example, he may feel the taste of his favorite dishes or may feel the taste of something which he does not like. And then olfactory hallucination. The patient may feel the smell of something, but that is not there. Sometimes a person may wake up from deep sleep in the midnight and smell something very unpleasant. Or he may be feeling the bad smell is coming from his body, but actually he is fresh. There is no bad smell. That is weird, right? However, the person may feel also something good, maybe a very soothing smell of a flower or perfume, but nothing is there in real. This is olfactory hallucination. So, these are the 5 major types of hallucinations. Now, come to another terminology, that is delusion. Delusion is very commonly developed by the patients who have psychosis. What is it? Delusions are firm, false beliefs which are held very strongly in spite of evidence to contrary. For example, if we take the same person again working on his laptop in his room, suddenly he noticed a big snake is on the floor. After watching the snake, he started to shout out of fear. By listening to his shout, the other members of the family came into the room and he started shouting like, "There is a snake, just kill him." But the family members did not see any snake. Rather, they found that it was just a rope. Then the family members tried to make him understand and convinced that this is not a snake, this is just a rope, you were seeing this wrong. But the person did not believe his family. He is still saying, "This is a snake and just kill him." So, what is happening here? This person is strongly believing that this is a snake in spite of having evidence that it is just a rope. This firm and false belief is delusion. I hope you understand, just don't get confused with these terms. In the same example, if the person was convinced by his family that it was not a snake but a rope, then we would say he had illusion. But as he is strongly believing his false perception, that is delusion. Now, one thing I need to clear that delusion is firm, false belief, but does not originate from person's religious, cultural, or social belief. For example, a person following X religion believes that he has angels with him who are always there to protect him from danger. He believes in angels. Now, someone from Y religion who does not believe in angels cannot say that the person following X religion is having delusion, because it was his religious belief. So the definition comes like this: delusion is firm and false belief in spite of evidence to contrary, regardless of person's religious, cultural, and social beliefs. Now, thought disorders. This leads the person to complete incoherence in their thinking, speaking, writing, and everything. This may be randomly spoken words, collapsing, or sudden stopping in talking. They're used to instantly getting lost what they were thinking or talking about right this moment. So, psychotic patients may suffer from scattered thought processes, that is, they may develop disorganized or disjointed thoughts or behaviors. Agitation means that a person is restless or excessively worried about something. Nothing, nothing can make him settle down. This is characterized by increased verbal or motor activity as well as restlessness, anxiety, tension, and fear. And aggression may get developed due to agitation. Aggression is a verbal or physical behavior arising from innate drive of the person. Due to his restlessness or frustration, he may lash out or tries to hit or hurt someone. This kind of psychotic becomes a threat for other persons. So, these are the cardinal features that a psychotic patient may develop. There may be some other symptoms which are related to the mood and behavioral alterations. Different patients may develop different symptoms, but not all of them. I hope you understand now what is psychosis and the other psychiatric terms. Now we will start pathophysiology of psychotic disorder. There are numbers of psychotic disorders. The most common and important psychotic disorder is schizophrenia. Schizophrenia is a very serious psychotic disorder or thought disturbances which is characterized by abnormal behaviors and lots of other symptoms. When people with normal personality develop schizophrenia, some symptoms start appearing. The positive symptoms, the symptoms develop in addition to the patient's normal personality, and the negative symptoms, the certain features which are removed from normal personality. Positive symptoms are delusions, hallucinations, and disorganized thoughts, speech, and behavior. And the negative symptoms involve loss of interest in anything, affective abnormalities, that is, severe mood disturbances, then avolition, loss of motivation, flattened emotions, it means reduced intensity of emotions, there is no fluctuation of emotion in joys or sorrows, and social withdrawal. They do not like to interact much with people, they develop their own world. So, with the symptoms, schizophrenia is basically a splitting of mind. Schizophrenic patients do really suffer a lot, but the saddest part is this pathogenesis of the disease is not clearly understood yet. From where the disease starts, why it starts, nothing is completely clear. But there are hypotheses on the development of schizophrenia. And currently, all the antipsychotic drugs used are symptomatic. This is not sure whether they can alter the pathogenic process, but they can alter the symptoms. Schizophrenia affects around 1% of the world population. That is huge. But it is thought that psychosis is nearly common as diabetes because not all the sufferers admit their sufferings, and even there is a tendency of keeping this patient hidden and isolated from the family and society. Next, there is no therapy that can completely cure the disease. And the saddest part of this disease is most of the time it starts when life is most beautiful, in adolescence. They enter into a false world when they are supposed to enjoy the life to their fullest. Okay, schizophrenia is divided into stages or phases. Each phase is marked by specific symptoms and signs. They seem to cycle through three phases in order. The prodromal phase. This early stage is often not recognized until after the illness has progressed. This stage is common to many other conditions such as depressions and social withdrawal. They like to stay alone and within themselves. In the active phase, patients develop more severe syndromes such as delusion, hallucination, and thought disturbances. Following the active phase, the patients often enter into a residual phase. This is a time when individuals with schizophrenia have fewer obvious symptoms. The psychosis is said to be muted for certain times. However, the symptoms are still present. Symptoms after this phase of the illness resemble symptoms in the first phase. They are characterized by low energy, lack of motivation, etc. And again, they can relapse back to the active stage. So, these are the three phases of schizophrenia. Now, let's come to the pathophysiology. I already told you that the pathogenesis is not clearly understood yet, but there are some hypotheses. And among the hypotheses, the most accepted one is the dopamine hypothesis. It is believed that persons who develop schizophrenia, they have increased dopaminergic activity in certain parts of central nervous system which concern with thought, perceptions, behavior, and motivations. There are few evidence for this hypothesis to be accepted mostly. Number one, initially developed all the antipsychotic drugs are D2 receptor blockers, dopamine 2 receptor blockers. There are 5 types of dopamine receptors in the central nervous system. Among the 5, D1 and D2 are found in the highest density in nearly all the pathways involved in dopamine transmission. And all the developed antipsychotics are used to block dopamine 2 receptors. Number 2, drugs that increase the concentration of dopamine in central nervous system is responsible for developing psychosis or schizophrenia. For example, levodopa is a precursor of dopamine that increases the concentration of dopamine in the CNS. Another drug, amphetamine, also increases the concentration of dopamine in CNS. So, say taking a levodopa or amphetamine or any other drug that increase dopamine concentration are found to develop psychosis in normal patients. And then it was found that patients with schizophrenia have overexpression of dopamine receptor in brain compared to normal people. Another evidence is PET test. Positron emission tomography scanning was done on the brain of psychotic and normal people. This is an imaging test that helps reveal how the tissues and organs are functioning. So in PET scanning of brain, psychotic patients were found to have increased dopamine 2 receptor density compared to normal. This is a hypothetical PET test value. Psychotic patients not treated have the highest concentration of dopamine 2 receptor. And one more evidence. The metabolism of dopamine produces a metabolite that is homovanillic acid. This is one of the major metabolites of dopamine. Patients taking antipsychotic drugs are found to have decreased level of homovanillic acid in cerebrospinal fluid as they improve with the drugs. So these are the reasons why dopamine hypothesis is accepted widely. So now we can say it is believed that in psychosis, dopaminergic activity is significantly increased. All the antipsychotic drugs block the dopamine receptor in the brain and periphery. Most of the antipsychotic activity of drugs are related to dopamine 2 receptor, and some drugs have some activity on other receptors. Now, we will go to the mechanism of action of antipsychotic drugs. First, let us see the dopamine pathways in the CNS. The pathways by which dopamine is transmitted and how it controls the behavioral characteristics during psychosis. Two main areas in central nervous system are affected due to psychosis, the limbic system and the frontal cortex. Here in the limbic system, a region is a ventral tegmental area, a VTA, and another is the nucleus accumbens, NSE. A neuronal pathway travels from the VTA to the NSE, and this pathway from VTA to NSE is called the mesolimbic pathway. Here, 60% of the neurons are dopaminergic. This pathway is associated with motivations, emotions, feelings of pleasure and reward. The overactivation of dopaminergic neuron in this pathway is thought to be responsible for developing positive symptoms such as hallucinations, delusions, and thought disorders. The next one is the mesocortical pathway. A neuronal pathway travels from the VTA to the PFC, that is prefrontal cortex area. In this pathway, dopamine is transmitted from VTA to PFC, but in psychosis, this pathway is thought to remain underactive. This also deals with the emotions and behaviors, but underactivity, it means less secretion of dopamine in this area causes the person to lose some of its characteristics, such as loss of feeling of pleasure or sorrows, loss of motivation, loss of emotional attachments, and loss of social involvement. So, we can understand that in psychosis, the underactivity of mesocortical pathway is responsible for the development of negative symptoms. This is a bit interesting. Positive symptoms mean some new things are added to the personality, and negative symptoms mean some things are removed. So you see the mechanism. The mesolimbic pathway is increasing the activity of dopamine and add new characteristics as positive symptoms. And the mesocortical pathway decreases the activity of dopamine and removes few characteristics as negative symptoms. Now I will show you another pathway, the nigrostriatal pathway. To see the pathway, we need to look at a few more areas in the limbic system of the CNS. This is substantia nigra, SN, from where the dopamine projection of this pathway is started. The neuronal pathway from SN is projected towards the striatum. Striatum has some other cell bodies such as caudate and putamen. This pathway is responsible for the motor function of voluntary organs, such as coordination of movement of the person. Deficiency of dopamine in nigrostriatal pathway may cause loss of control over movement coordination. So you see, all the antipsychotic drugs are dopamine inhibitor. So a psychotic patient, when taking antipsychotics, along with the mesolimbic and mesocortical pathway, the drug may affect the nigrostriatal pathway also. Then dopamine will be reduced in this pathway and cause some side effects called extrapyramidal side effects, that is Parkinson-like syndromes. Now, the last pathway is the tuberoinfundibular pathway. The neuronal pathway is originated in the hypothalamus and projected towards the pituitary gland. Dopamine in this pathway regulates the synthesis and secretion of prolactin hormone. Increased dopamine causes decreased prolactin, and decreased dopamine causes increased prolactin. And when prolactin is increased, it is responsible for amenorrhea and galactorrhea. So, the patients taking antipsychotic drugs may have some side effects due to inhibiting the dopamine in the tuberoinfundibular pathway. Now, let's have a review on all the pathways. Remember, all the antipsychotic drugs are dopamine receptor blockers. They decrease dopamine. In psychosis, the mesolimbic pathway has increased levels of dopamine and causes positive symptoms. Antipsychotic treatment will improve the situation that may not have a hallucination or delusion anymore. The mesocortical pathway has decreased level of dopamine and causes negative symptom. As antipsychotic decreases dopamine, it seems that the antipsychotics is going to worsen the negative symptoms. We'll come back here later. The nigrostriatal pathway is concerned with the extrapyramidal effects. Antipsychotics may cause Parkinsonism or Parkinson-like syndromes as a side effect. The tuberoinfundibular pathway is related with the synthesis and secretion of prolactin. The antipsychotic drugs may cause amenorrhea or galactorrhea due to the decreased level of dopamine. Now, what do you think? We have seen the positive symptoms are improving, but negative symptoms worsening. Is that it? Or will the negative symptoms keep on worsening during the course of antipsychotics? Not really. It has been observed that the positive symptoms go away before the negative symptoms. The patient may not have delusion or hallucination, but his lack of interest or depression related symptoms tend to stick for a long time. Moreover, there are some antipsychotic drugs which also improve the negative symptoms. That's why this is not technically correct that the antipsychotics keep on worsening the negative symptoms. Now, there are two types of antipsychotics. Typical antipsychotics, the first generation. These typical antipsychotics have a strong affinity to dopamine 2 receptors. These are effective in improving positive symptoms of schizophrenia. They cannot improve negative symptoms. Typical drugs also partially affect motor function, leading to motor impairment. They develop extrapyramidal side effects. These are some of the typical antipsychotic drugs. These drugs may also develop weight gain, sedation, hypotension, orthostasis, that is an instant fall of blood pressure after standing or sitting up, and priapism, the persistent and painful erection of the penis. The next one is the atypical antipsychotics, the second generation. The atypical antipsychotics block the dopamine 2 receptor but has weak affinity compared to the typical drugs. In addition to that, these drugs have serotonin blocking affinity. Atypical drugs can work on positive symptoms and negative symptoms together and improve the physiological condition. Due to less affinity to dopamine compared to the typical, atypical drugs have less motor impairment effects, so extrapyramidal side effects are not commonly observed. These atypical antipsychotics have the same side effects as the first generation, as well as hyperprolactinemia and agranulocytosis. These are some of the examples of atypical antipsychotic drugs. So, the question may arise, If the second generation can improve both the positive and negative symptoms, and also they do not cause extrapyramidal side effects, then why the first generation drugs are still used? Because the first generation drugs are more affordable than the second generation drugs. As the drugs should be taken for a long time, many patients and prescribers also prefer first generation drugs because there are a lot of patients who stopped their medicines after a certain time due to the cost. Moreover, sometimes atypical drugs are said to be the last option to handle the patients who are resistant to all antipsychotics. Uh, Alright, so I hope by now you understand all about a psychotic or a schizophrenic patient, or what are the symptoms and how the antipsychotics are working. I hope you like the video. If you have any question, just put a comment and click the subscribe button for more videos. Thank you.